Hello guys, I hope you're doing okay. Today we're going to talk about anal cancer. Anal cancer is a relatively rare type of cancer, but it exhibits a great diversity due to the variety of tissues present in this region. This diversity is reflected in differences in the type of cancers. Tumors located at the margin are similar to skin cancers. This is explained by the fact that anal margin is skin-like tissues, while anal canal cancers are squamous cell carcinomas in 95% of cases, meaning they form from squamous cells of the skin or mucous membranes. The majority of anal cancers develop in the anal canal. Approximately 85% of anal cancer cases affect this area, while the remaining 50% involve the anal margin. Early diagnosis of the anal cancer is based on a clinical examination, often through a digital rectal examination, and diagnostic tests based on histological analysis. The treatment of anal cancer depends on the size, location of the tumors, as well as its stage. In general, therapeutic options include surgery, radiotherapy, and sometimes chemotherapy, which can be also combined with radiotherapy. The prognosis for people with anal cancer is generally excellent if the disease is diagnosed early and the management has been quick. Well, there's so many risk factors related to this anal cancer. Being a female is a risk factor. Although men are also affected, studies have shown that women may be more vulnerable to anal cancer.
Oh my God.
Smoking is a major risk factor for many diseases, including anal cancer. Smoking increases the likelihood of developing various types of cancer. Next, HPV infection. HPV is one of the main risk factors for anal cancer. HPV is a sexually transmitted virus. Next, history of cervical cancer. Women with a history of cervical cancer are also at an increased risk of developing anal cancer. And men who have sex with other men or homosexual are considered a high-risk group for anal cancer. This population is more likely to be exposed to HPV through anal intercourse, which increase the risk of developing precancerous lesions and eventually anal cancer. Finally, HIV infection or human immunodeficiency virus. People infected with HIV have a weakened immune system, making them more vulnerable to persistent infections, including HPV. We will talk about symptoms, diagnosis, and treatment in the next videos. If you like this video, best thing you can do is liking it and subscribing. Thank you so much for watching until the end, and I'll see you in the next one.